All right, guys, so if you've been having right-sided low back pain, having trouble to get that right glute to fire, you just kind of feel jammed up on the right side, maybe your knees caving in when you squat or you do your lunges and step-ups, this is going to be a good video for you. Me and Becca are working one-on-one here to try to figure out what's going on her right side that she keeps getting jammed up when she gets into her lifts. So we go through some assessments, some things we looked at to figure out if her right glute was firing, some stretches that we're using with her to try to get that to release, and then some exercises we're using to reinforce that position. So if you've been feeling jammed up on the right side, you're having trouble controlling that knee on the right leg, this is a great video for you. I think you'll find a lot of good little information in there. So I hope you enjoy and stay tuned. I'm here with Becca. We've been working on some things where she's just feeling jammed up on her right side and her low back. It gets better, but then as soon as she squats again or something along those lines, it jams up again. So we wanted to look at what's happening on the right side. A lot of time if you're feeling tight in your right back, it's because your right glute isn't activating well, so you compensate by extending your back versus extending and rotating your hips. So we put her in a clamshell position and we would test it. We put her in just a generic clamshell. We said, okay, lift up. She rotates up. I push down. When we first tested this, she said, I said, where'd you feel it? And her back definitely tightens up. You can actually see her back arch here. And then she would get this, pulling sensation or activation sensation through the hamstring and a little bit through the lateral quad almost. So we started with fiddling with different ways of where do we got to put her pelvis so that she can get back into the glute, because for whatever reason she's not activating the glute. And what we found is that if we gave her a little bit of left adductor activation, that got some of it into the glute, but what really seemed to change it the most is we changed her pelvic position. And all I did was grab the top of her pelvis on the right and I shoved it down. Okay? She activates her left abdominal region, I keep her pelvis shoved down, she lifts up, right? And now it's real nice, it's in the glute itself. So what we want to do with her is we want to find a way to make sure we can keep that in the glute and make sure she can keep her pelvis more level so that when she's doing her squatting and her lifting, she's not jamming up her back. There's a muscle. It runs from the 12th rib to the top of your hip crest, your iliac crest here. It's called your quadratus lumborum, or you'll hear us say QL a lot of the time. That muscle, if it's in spasm, it's going to keep this hiked up, this pulled down, right? So we need to do the opposite of that. So what we're going to start with her is we're just going to do a release of her right side, try to get that QL to let go. So what we started her with is on the wall here. We need our hip crest and our 12th rib to come across. So I'm going to reach up with my right arm, make sure that my scapula elevates nicely. I'm going to kick my right foot down behind me so that it drops my right pelvis. And then I'm going to lean my rib cage to the right. If I can pull the rib cage apart, let my pelvis drop, it's going to create some space on that right side. So Becca's going to go ahead and set that up. Right arm's there. You can see her right pelvis start to drop. You can see this right rib cage elevate. We can even shove her ribs to the right a little bit more. That pelvis reaches. She's active through her right leg, reaching behind. Now we get this gapping effect here. Because that QL is attached to the 12th rib, an inhale is going to really increase that stretch. So when she inhales, she's focusing on in through the nose and inflating this right side wall. If I can get this right side wall to inflate, it's going to create more movement through there. A full exhale, and I would hold this for somewhere between 3 and 5 breaths. Okay? So this is our reset, if you will, right? We're resetting her pelvic position, trying to relax some of the musculature on this right side wall. After that, we need to reinforce it with some kind of exercise. So we're just going to go back to the clamshell to keep things simple. And she's going to try to set up that exact same position that I did manually. So she's going to activate her left ab wall, pulling her left pelvis up, left rib cage down, creating tightness there. By doing that, she's also going to let that right side drop. So she's actively creating that same shift that I did manually. As she goes into her clamshell, she should feel it in that right glute. If she doesn't, she's got to keep manipulating and tightening and moving her pelvis around to where she can find this movement where we want it to be. Once she can learn how to activate that glute in a lying position where she's supported, we'll stand her up and we'll try to transfer that into a step up, a lunge, or a squatting position where she can maintain that same pelvic posture and activate her glute. That's how we're going to get that transfer from floor to standing and what she needs. Give that a go and good luck.